Joining us right now is Congresswoman Debbie Wasserman Schultz. She's the House Chief Deputy Whip. She's also a Congresswoman from Florida, so I'm sure she's interested in that last report we just gave. What a situation down in your home state. Meantime, there's a weather situation of its own in Florida as thunderstorms move across Capitol Hill in the form of politicians trying to get a deal done on health care. Let me start with this. Do you think Nancy Pelosi has the votes? Everyone's talking about, does she have 216? Does she have the Stupak anti-abortion coalition? What's your take on it, Congresswoman?
We will have the votes, and we're still in the process of working with members and talking to them about what's in the bill and what the changes to the bill that will be amended by the reconciliation provisions. But I believe when we have the vote, the votes will be there, because our members understand that we've got to get a handle on costs. We've got to make sure we cover the people that don't have health insurance, and we've got to provide some security and stability to the 85% of Americans that already have insurance. It's incredibly important.
How do you vote on a bill that you don't actually have in hand? You know, Congressman Anthony Weiner, who comes on the show, and he said it's very hard to count the votes without a document in front of you.
Well, Megyn, we've got a bill. We've got the Senate bill, which is the base of the health care reform proposal that we're going to be voting on. The reconciliation bill will just be the changes that are going to be made so that we can split the difference between the House bill and the Senate bill. So we actually had a full briefing in the Democratic caucus this morning on the content of the bill. We had a briefing from the White House Health Policy Director Nancy DeParle. So members are becoming more and more familiar with what's in the bill, and in fact, we are going to make sure that before we vote on it, it'll be up a week in advance on the internet for everyone to take a look at. So there's going to be plenty of time for people to review it, and we've been being briefed on it as we speak.
Will that be right now?
The bottom line here,
today is a week before the vote that the White House wants.
No,
on March 18th.
Well, the White House doesn't set the congressional calendar, so we're talking to the White House, but our congressional leadership is working diligently to try to hammer out the final product and make sure members are fully briefed. We'll put the bill up on the internet once that happens, and then it'll be about a week until we vote. But the bottom line is that Americans really want and understand that we have to end insurance company abusive practices and put health care back on the side of the consumer.
What about, I mentioned the anti-abortion coalition. You know, there's Stupak says he's got 12 voters who are going to say no to this bill unless the language on abortion is changed, and both sides are saying that's not really something that you can do in reconciliation because that has to relate to budget. And anyway, he's a no for now unless the abortion language is changed. What's being done about that?
Well, we're continuing to talk to the members on both sides of the aisle. There are plenty of members that are pro-choice that are very concerned about that language as well. So the good news is that the negotiations continue. There's a lot of discussion. No one's left the table. And I think we're all very confident that everyone understands that making sure that we can end the insurance company abusive practices, making sure that we can put doctors and patients back in the driver's seat when it comes to health care decisions and cover everyone and bring down costs are the main points.
You're pro-choice, and I know that a lot of others in the House are as well. Could you agree to the language that Bart Stupak wants?
The language that's in the Senate bill is the language that I think makes sure that abortion is not addressed in health care and maintains the status quo. That's the language that I can live with.
So no to the Stupak language. He didn't like the Senate language.
Well, like I said, we're continuing to negotiate, and we'll see what we can come up with. But I'm confident that everybody understands the stakes.
We are going to be watching as you do. Congresswoman Debbie Wasserman Schultz, all the best to you. Thanks so much.